Branches of vagal nerve. Superior laryngeal nerve. Nerve of fourth pharyngeal arch. It divides two branches. Internal laryngeal nerve supplies laryngeal mucosa till vocal cords. External laryngeal nerve supplies cricothyroid muscle, tensor of vocal cord. Recurrent laryngeal nerve. Nerve of sixth pharyngeal arch. It supplies all larynx muscles except cricothyroid muscle. It also supplies the laryngeal mucosa below the vocal cords. It is followed by inferior thyroid artery. External laryngeal nerve. It is a branch of superior laryngeal nerve. It supplies cricothyroid muscle. It is followed by superior thyroid artery. Therefore, during thyroidectomy, ligate the superior thyroid artery as close to the gland as possible to avoid injuring the external laryngeal nerve. Ligate the inferior thyroid artery as close to the gland as possible to avoid injuring recurrent laryngeal nerve. Superior thyroid artery, avoid injuring to external laryngeal nerve. Inferior thyroid artery, avoid injuring to recurrent laryngeal nerve. Muscles of larynx. Cricothyroid muscle, thyroarytenoid muscle, posterior cricoarytenoid muscle. Cricothyroid muscle. It attaches the thyroid cartilage with cricoid cartilage. It is the tensor of vocal cord. It increases the pitch of voice. Thyroarytenoid muscle. It attaches the arytenoid cartilage with thyroid cartilage. Vocalis. Inner part of thyroarytenoid muscle. Anteriorly it is a tensor of vocal cords. Posteriorly it is a relaxer of vocal cords. Posterior cricoarytenoid muscle. It is the most posterior muscle. It is the safety muscle of larynx. It is the only muscle which can abduct the vocal cords and aid in breathing. Bilateral paralysis of posterior cricoarytenoid muscle causes the closure of larynx. Hence, tracheostomy may be required to help the patient in breathing. Posterior cricoarytenoid muscle, safety muscle of larynx, only muscle which can abduct vocal cords. Thyroarytenoid muscle, anteriorly it is a tensor of vocal cords, posteriorly it is a relaxer of vocal cords. Cricothyroid muscle, increases pitch of voice. Important information: all laryngeal muscles are adductors of vocal cords except posterior cricoarytenoid, which is the only abductor. Hypoglossal nerve. Cranial nerve 12. Transverse section of medulla region. It originates from medulla oblongata, sandwiched between pyramid and olive on the anterior aspect. Posterior lateral to olive emerges the cranial nerve 9, 10, 11. Hypoglossal nerve nucleus is present on posterior aspect of medulla at the floor of fourth ventricle. Dorsal column, medial lemniscus system, which carries 5 sensations: pressure, touch, vibration, stereognosis. Conscious proprioception can be seen medial to hypoglossal nerve. In medial medullary syndrome, contralateral spastic paralysis due to damage to pyramidal tract system. Contralateral loss of 5 sensations due to damage to medial lemniscus. Ipsilateral paralysis of tongue muscles due to damage to the hypoglossal nerve nucleus. Originates from medulla oblongata, sandwiched between pyramid and olive on anterior aspect. In medial medullary syndrome, contralateral spastic paralysis. Contralateral loss of 5 sensations. Ipsilateral paralysis of tongue muscles. Contralateral spastic paralysis is due to damage to pyramidal tract system. Contralateral loss of 5 sensations is due to damage to medial lemniscus. Ipsilateral paralysis of tongue muscles is due to damage to hypoglossal nerve nucleus. Ipsilateral paralysis of tongue muscles is due to hypoglossal